normal for families to feel like their parents had gone from being a person to feeling like just a number in these 100 plus room facilities? Because sometimes, like, because they are like these facilities treating every member like same way, but sometimes, like as you say, like something happen and they need more attention or more care, but it seems like they are generic or they are just a number in a room.
So, if the question is about the family members, it all depends. And when I say that is everybody's different, everybody has a different perception of things, and everybody has a different way on accepting or not accepting the reality. And I've worked with family members in the past where, even though mom had a clear diagnosis of dementia or Alzheimer's, you know, the daughter was still, or she still seemed to be surprised, when she was noticing that mom has memory issues, or she couldn't remember what she had for breakfast, or was asking the same question, 3 times in 5 minutes or 10 minutes. And the daughter is like, wow, how is that happening? Because mom never did that before. But mom was diagnosed with dementia or Alzheimer's 2 or 3 years ago, and things have progressed, and more symptomatic issues are coming up. But some families, they have a harder time to accept the reality versus others. Um, yeah.
So, like you are exactly like answer my next question is like most of the time like families feel or often like realize like the stuff is nice, but my parents still seem worse. And when you hear that, what's usually happening behind the scene? And like as you say, like sometime like uh, uh family member diagnosed like the memory issues or any other issue. So, like, what actually happened when a facility tells a family we can't handle your parents here anymore? And how should family understand that moment, because that is like kind of the heartbreaking moment, because they are not ready for that, they don't have any idea, they are not aware about that situation.
Yeah, definitely that is a, significant moment in everyone's life that it's involved in that. Um, Usually there is a progression of things that ultimately leads to a facility, an assisted living, to tell the families that their parent living there is not appropriate any longer. There is quite a bit of things happening prior to that particular moment. And the normal progression of things would be, let's say, the staff notices that this resident is starting to have more memory issues, or she's starting to be more having physical issues, meaning that she's having more and more poor balance. Uh, she had a fall a couple of days ago. Luckily, nothing major happened. She didn't break anything. And then walking to the dining room from her room, the staff notices that the resident is wobbling a little bit, or she just doesn't have the same balance as she used to. So at that time, um, the normal progression of things would be to have a conversation with the resident, to notify the family members, to have a meeting with the resident and the family members so the staff can address those issues. Um, Now, for someone being um, having some ambulatory issues, that's not a reason to ask someone to move out of a facility. But One technicality that a lot of people don't know is that all assisted livings, they're called assisted livings, but each one of them is licensed differently. And depending on the licensing they have, they can or cannot provide certain services. So if a resident, either due to aging in place or change in their cognitive or physical condition, they get to a level of care or a level of services that they need where the facility doesn't have the proper licensing for it, then that would be a moment when the facility would ask the family and the resident to come and have a conference. Usually it's called a care conference where they can discuss those issues. And if the conclusion of that meeting is that the facility is just not able to provide the services that the resident currently needs, then there are two options. One would be to hire a private caregiver that the resident has to pay on top of what they already pay the facility, or the resident to move to another facility that has the proper licensing and the proper staffing to accommodate their needs
So
and in the future, so they don't have to move again.
yeah,
That's why families and the residents themselves, whomever is part of the process of choosing an assisted living, they have to know what questions to ask, and they have to really find out what that facility is able to provide as a level of care, or what they're not able to provide. Because sooner or later, the resident living in that facility would get to a point where the question will come up if the facility can accommodate their their needs or not any longer. And it a lot has to do with the type of licensing that the assisted living facility has.